Vergara. I come from Colombia.
Hello, good morning. My name is Christina Hinlo. I will be 79 years old in March. I have been here in Canada for 3 years.
My name is Asma and I'm coming from Saudi Arabia basically, but I'm an Indian who lived in Saudi Arabia for 13 years.
My name is Elizabeth Mushoba. I come from Kenya, that is in East Africa. I have been in Canada for the last 9 years.
Hello, my name is Manjuman Ara. I'm from Bangladesh. I have been living in Canada more than 2 years.
In my country home, the service medic is particular and the government. The government for people working in any industrial company, it provide for any people who working in any status pay for insurance. It's very expensive. And when come here Canada, I see the service medic is very important for all people because it's free, very good. In this moment, next week, February 22, I have a second surgery in Brampton. I am waiting for this service, and the rest is good service. Yeah, finish my problem for the surgery.
Regarding healthcare, I want to say that I like it here in Canada. In fact, where I come from, the Philippines, we don't have this healthcare system that you have here. In the Philippines, if you don't have money, they will not admit you even for consultation in the hospital. So the poor really gets nothing, even from the government. And we have a hospital there, a government hospital, where all the poor people just lay on the corridors and wait for somebody, to have pity on them. I guess I am just lucky that I was able to go to the States. And I thought that it was better there. But then, there I have to have co-pay for my daughter, since I'm just a housewife, I didn't work. So I have to, my medicine is being undertaken by my daughter, and she has to pay, But then I was also sponsored by my daughter here in Canada because she says that healthcare here is better.
Regarding the Medicaid system here in Canada, it really attracted me as one of the most important things for new migrants who have been coming in for the first time. First, it's surprisingly, when we came to know that the Medicaid system here is free of cost, it was really exciting for us. So there was no tension that we have to use lots of money, spend lots of money using these services here. Basically, back home, we have good services over there. Medicaid system is good, but we have to pay for everything. And when we have to pay for everything, there are certain facilities which are not available in places like metro cities. There are few cities only have good Medicaid system in India. So we need to travel across to go to the city. And if, for example, my father, he had cancer, and for him to survive, he has to go under a surgery. It was not available in my city, where I come from, Hyderabad. We had good hospitals over there, but the doctors suggested that we have to take him to Bombay. So we went to Bombay, and we have to stay there for a month's time till he recovers back, and it was a lot of cost for him. Many rich people can afford this in India, but basically the people who are poor people cannot afford that in India. And when we came to Canada, as a new immigrant, it was very difficult for us to have a survival life here. So this Medicaid system really helped us to make it, comforted us actually, to say in good words, that there is no cost for this, and we would this system will help us in future new immigrants who ever come here.
The good thing that I like about OHIP when I compare it with the health system in my country is that in my country everything, every medical service you have to pay for it. My mother was sick for 4 years and everybody in the family had to take loans from the bank to meet the medical bills, which was a very big burden for everybody. But here in Canada, I find that you don't have to do that. When a member of your family is sick, you just go to the hospital and they get the treatment that they need. That is a big relief to everybody, especially those people who have come from for immigrants. The other thing I find is that since when I've been here, I've had 2 children, and when I went to the hospital, I did not have to pay for anything.
You are asking about experience living in a country without Medicare. Yeah, I would say without Medicare, a country without Medicare, it's really, just kind of living in a hell. I can give you an example. In our country, just 1 year back, my father got heart attack, but my sister called for ambulance, for doctor. It was about midnight, and it was really sad thing that we couldn't reach any ambulance and a doctor. So after 30 minutes, we were able to take my father to hospital, but by this time he just gone. So it's really bad from my personal experience. Just when we came here as a new immigrant, me and my husband was not working, and my husband got suddenly heart attack, and I was really scared what will I do. Then my husband told me, you need to call 911, and I called 911, and the doctor and ambulance and doctor came. Within 5 minutes they came here, and they also told me that my husband got a severe heart attack, and they did everything themselves, and they also called to the hospital because he needed surgery. And I can remember that within 45 minutes he just got his heart surgery, and he was good, and you know what, it was totally free.
When you go back to your constituency and you run into somebody who says that, oh, it's a good idea for you soft-hearted humanitarians, but we can't afford it, let me give you a simple statistic which you can put down on a piece of paper and carry in your head. And that is that our friends in the United States are spending 9% of their gross national product. They get a higher per capita gross national product than we do. They spend 9% of their gross national product on health care, and 34 million of their people have no health care coverage. And in Canada, we spend 7% of our gross national product, and every man, woman, and child in Canada is covered under Medicare. If you want a 2-tiered health program, then just continue the way we're going. And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child, irrespective of their color, their race, or their financial status, and by God, we're going to do it.